Hello everyone, it's Dr. Regu. I'm one of the GPs here. Today I'd like to do a video on how to be able to do some notes quite efficiently and quickly on the EMIS. This is a video for trainees, but if anyone finds it useful, please go ahead and use it. So what I have got on my screen is a test patient. That's a female, 66-year-old. I mean, for these purposes, 66 years old is fine, but if you want to think about as a slightly younger, 40, 45 years old, then that would be more suitable for the clinical scenario. I'm going to do it as an example. So I'm going to do an example, middle-aged woman coming with urinary tract infection symptoms. And I've spoken to her. She needs some antibiotics. She's otherwise well. So I just would like to do the notes after I've spoken to her. I know some of you are very good in typing the notes while speaking to the patient, but I'm not, and I usually do my notes after speaking to the patient. So therefore, I try to be quick in typing the notes. So let's go ahead and do this example. I'm going to show you in live time how quickly I can do these notes. And I will explain how you can do this or how we can do this together as a team. Okay, here we go. So this is a patient I spoke to on telephone and start now. Okay, so the consultation notes is done. I'm going to save it and I'll run through what we have done. So it's better to open this consultation as edit so that it's easier for me to show. So the first I typed, as we are mostly doing telephone consultation, I typed as telephone encounter. So that's code. Then I used text expander or a quick code to say that it was a telephone triage due to COVID-19, spoke to patient, confirm identity, and it's safe to continue telephone consultation. And then a history, which is also a quick code. I'll show you what it is and how we do it. So urinary symptoms for 3 days, urgency, frequency when trying to pass urine, nothing coming half the time, small amount of blood in the urine. Urine was cloudy, had mild odor, no fever, shivering or rigors, no renal angle tenderness, eating and drinking normally, opening bowels normally, no other symptoms. And then no significant past medical history, not on regular medication, not known to have any drug allergies. So this information is usually needed for hub because I worked at the hub as well. Every time we see or speak to a patient, we usually check their past medical history in the hub, whereas in the GP surgeries, we have it already in our records. And then I go ahead and say examination findings, mentally alert, coherent, talking full sentences with normal tone and volume, no signs of respiratory or pain distress. And then in comment, advice likely UTI, advice fluids and trial of antibiotics, advice to see how the patient is getting on, if the symptoms are persisting or getting worse, or if any symptoms or concerns, come back to the GP hub or call their own GP or call 111. Again, this was a short code I used in hub, which I used it here in the surgery. But again, it depends. It's kind of self-made codes. You can make your own code. You can edit your code. So now this is what I have documented. It took me less than a minute. And how did I do it? How do you do the quick codes? That is this quick video is about. So before we go ahead and show you how to do it, I'm going to save this and give you a disclaimer. So any quick codes you use, regardless whether you put it as a quick code or someone else in the surgery put it as a quick code, whatever the medical information you type or you put it as a quick code is your responsibility to check that is the intended nodes that you wanted to put in. Because some of my colleagues know that I use these codes and they are using these codes as well. That's fine with me. But for example, telephone triage did COVID-19 spoke to patient. They put this quick code on a child, so it's not relevant. They could have not spoken to a child of 3 years old. So you have to be careful. You have to edit your code accordingly. You have to edit your notes. So this can be used as a generic form, but every individual case will change, and you have to edit it accordingly, and that's your responsibility. And I am only trying to help you that you could save some time by doing this, but these codes are not applicable for any and every patient. So how do you do these codes? So I went into CR configuration here. When you're on the consultation tab, go to CR configuration, click on that once, and you'll get this screen. So if you go down here, quick codes and text. So if you just click on that, so I have number of codes that you can see there. So I'm going to show you some, for example, let's say the urinary tract code that we used. So UTI here. So I click on that and say edit. Okay. So the shortcut, which is a triggering word, or the shortcut that you type in order for you to be able to get that code onto your notes. I've seen someone is already using these codes here for flu and blood tests and other things. That's fine. But what is it that, for example, if you type bloods in here and it comes as bloods taken or bloods taken with consent or whatever. But so that's a normal word. If you're typing it during a consultation, then if it's triggering a quick code, that's going to make the consultation or the notes entering for other clinicians difficult. So with my codes, I always have a triggering letter, either a letter or kind of a like a symbol. So in this case, the symbol is forward slash. So forward slash UTI is my triggering code or shortcut, and that's going to trigger these sentences. So urinary symptoms for 3 days, urgency, frequency. Here I forgot to put dysuria, but again, it's just an example. When trying to pass urine, nothing coming half of the time, small amount of blood in the urine. Urine was cloudy and had mild odor. No fever, shivering, rigors, or renal angle tenderness. Eating and drinking normally, opening bowels normally, and no other symptoms. So this is a quick code. All you need to put for all these to be entered is uh, triggering symbol forward slash and UTI, a 3-letter quick code. So I use quite often these type of quick codes for some information which is usually repetitive. Say for example, telephone consultation. Say where is it? I'll show you some examples here. So as you say that I used to do X and then the code, but then I moved to the forward slash and then codes. So I don't know if this is only just available for me or for everyone. You can go into your consultation and see if you can use this as well. So for example, if I get this, so this is the one I used to do in the past, but it's still valid. X TCX is a triggering symbol or letter. TC is telephone consultation, and the text would expand to say telephone triage due to COVID-19, spoke to patient, confirmed identity, and is safe to continue telephone consultation. So you can add, and some people I usually see um, the consultation carried out during COVID-19. So according to the current guidelines, it may vary um, from the normal guidelines or something like that. So this is a quick code which I almost use for all of my telephone consultation to make sure that um, to confirm that it was during COVID and to confirm that I spoke to the patient. So, for example, if I had spoken to a mum, so I just go here and edit. I spoke to patient's mum, not on the code, but after the code has been entered into the patient's note where I wanted to do that. So that's one. I mean, that's one example. So I've got plenty of these, and I'll go through some if you would like me to, or if you had enough, you can close the video and go ahead. Say, for example, um, okay, so I will go here, say that blood. Um, Okay, so this is one blood. So blood test form done, text sent how and where to have the blood test done, and to make follow-up arrange appointment to discuss the results. So this is a quick code. After I've done a blood test request, I just put this on so that I make myself clear that this has been done and patient knows if she needs to contact or she or he needs to contact us to get the results. So cancel that. And then there is another thing called say chickenpox. So this is advice about chickenpox, advice about the cause, how long they are infectious, school work exclusion policy, advice about paracetamol and not to take ibuprofen, to wear loose cotton clothes, for itching calamine lotion, for if itching badly, can get some Piriton over the counter, da 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 da. So this is just a long safety netting or patient advice, then I just put the code on. I mean, you have to be genuine about putting the code. So if you haven't given any of this information and you're just putting this code, then it's not correct morally and not genuine. So if you are giving this much of information, then you should put that. If you're only giving some information out of this, then you need to delete the rest of it once you put that on. Uh, so that's that. And then, say for example, if I've done a mental health crisis plan discussion, then I go into crisis, say the mental health crisis plan discussed. If you have any overwhelming thoughts or self-harm or any out of control feeling, and if you need urgent help, contact da 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 da. So it's again, um, it's something that a long sentence that you would have to usually type it up, but now you can put it on. But be honest with yourself. Just make sure that you discuss these or use this as a reminder to just discuss these with your patient and put it on your records. And okay, one another one I'll just want to show you. So this is another one of my favorites, say Ortex. So advice likely otitis externa, advice to automate ES spray trial, advice to take some painkillers, advice to see how patient getting on, if things are not getting better, come back, blah blah blah. So again, it has to be yours. You have to own it to use it in the sense like if you're using it, that's what you meant, or that's what you have discussed with the patient. So be careful with that. That's what I would keep emphasizing when you're using these quick codes. Um, I hope it helps, and I mean, if you have any further queries, please do contact me. But otherwise, hopefully, this will help you some time, save some time during the consultation, and then see how you're getting on. Thank you. Bye.